listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 36. Only one more month to go. You can see a picture of what your baby looks like this week, read the transcript, and access the additional resources at pregnancypodcast.com/week 36. Your baby is growing from a spaghetti squash to about the size of a bunch of romaine lettuce this week. They measure 18.6 inches or 43.3 centimeters, and they weigh 6.2 pounds or about 2.8 kilograms. At 36 weeks, your baby's skull bones are not fused yet. This allows for an easier journey as your baby squeezes through the birth canal. And most of your baby's bones and cartilage will harden completely over the first few years of life. At this point, your baby's blood circulation system is in place, its immune system has matured enough to protect them from infections outside the womb, and their digestive system is still developing. The first year or two of digesting milk and getting accustomed to solid foods will help mature their digestive system. 94% of babies will move to a head-down position by week 36. Of the 6% that are still breech, nearly 1 in 4 will move head down in the next 2 weeks. If your baby is breech, please discuss your options with your doctor or midwife. Beginning in week 36, you see your care provider weekly. Take advantage of more frequent appointments to knock out any questions you have about labor and birth. 1 in 5 women has herpes simplex virus type 1 or 2. Although transmission rates to a baby during pregnancy and birth are low, neonatal herpes is a serious condition that can have detrimental effects. ACOG recommends that expecting mothers with genital HSV take an antiviral from week 36 until birth. If this affects you, I'm sure you're discussing this with your doctor or midwife, and you can get more information at pregnancypodcast.com/herpes. Group B strep, or GBS, is short for Group B streptococcus, which is a bacterial infection. This bacterium naturally lives in the gastrointestinal tract and is present in the vagina or the rectum. According to the American College of Obstetricians and Gynecologists, the prevalence in pregnant women is between 10 to 30%. Most women with Group B strep do not experience any symptoms. Usually this isn't a big deal, but it can be an issue when you're pregnant. In the United States, it's standard practice to test all expecting mothers in week 36 or 37. This test involves a swab of your vagina and your rectum, and then that is sent to a lab. If the culture tests positive for GBS, the treatment is the administration of antibiotics during labor. And there's an episode of the Pregnancy Podcast that does a deep dive on prevention, testing, treatment, and how you may be able to reduce your risks. One thing that you may want to consider doing this week is starting to eat dates. The research is promising on the benefits of eating dates towards the end of your pregnancy to reduce the duration of your labor and the use of synthetic oxytocin. Sounds great, right? Based on the research, expecting moms in the intervention groups ate about 6 or 7 dates per day, which was about 60 to 80 grams. One study had participants consuming dates from 36 weeks. All the others started at 37 weeks. You can check out the Pregnancy Podcast episode on the research on eating dates, the proposed mechanisms of action, and recommendations for including these in your diet at pregnancypodcast.com/dates. Ideally, you wrap up all of your big to-do items this week so that you're heading into week 37 ready for labor. You should pack your hospital or birth center bag. If you're planning a home birth, you should wrap up getting all the supplies for that. Hopefully, if you're in a birth class, it is wrapping up this week. You may consider making padsicles, which are postpartum healing pads. These are easy to make by adding a few ingredients to feminine pads and freezing them. And there's an episode of the Pregnancy Podcast with simple step-by-step instructions. One thing that may be coming up as you get close to labor is the possibility of an induction. And there's a lot of reasons why your doctor or midwife may recommend an induction. And there's several methods that they can employ to try and induce labor. The different methods include stripping and sweeping membranes, using misoprostol or Cytotec, using Cervidil or Prepidil, synthetic oxytocin, which is Pitocin, using a laminaria or a balloon catheter, or even breaking your water. And each of these methods of inductions have pros and cons. You can learn more on inducing labor at pregnancypodcast.com/inducing labor. A tip for dads and partners. 73% of car seats are not installed correctly. Your child should be in a rear-facing seat for a minimum of 1 year. Once the car seat is installed in your vehicle, it should not move more than 1 inch side to side and front to back. The harness straps should be at or below your baby's shoulders. The chest clip of the harness should always be at armpit level. And the recline of the car seat is critical, especially for infants. An overly upright seat can allow an infant's head to fall forward, which can obstruct their breathing. Car seats have an indicator to let you know when you position them correctly. And if you're in the United States, I'm going to put a link to a website that shows locations where you can actually get your car seat checked. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for this episode at pregnancypodcast.com/week36. Next week, your baby starts getting dimples and little rolls of baby fat. Until then, I wish you the very best in your pregnancy journey.